When we think of memory function, it's not a unitary thing. It's not like memory is this one thing. Memory is of different kinds, of different types, and certain kinds of memory function might be particularly impacted by certain conditions. Alzheimer's disease, for example, tends to impact episodic memory, our ability to associate, to remember events, a lot more than it affects our ability to engage in what we call procedural memory. Things about how to tie our laces. So what we are trying to do is to learn more about these distinctions among different memory functions and develop brain stimulation devices, brain stimulation tools that are catered to each of those memory functions. And as we learn more about this, definitely there's a lot more scope. Our understanding of the brain will help us figure out what exactly is at the root cause of a given illness.
Welcome. Thank you for coming on.
Absolutely.
So, the lab, what's the mission of the Reinhardt Lab?
So the Reinhardt Lab, in which I'm a graduate student there, attempts to study cognition. And cognition involves several different abilities, things like how we learn things, how we memorize things, how we pay attention to things. Essentially, the different aspects of our regular day-to-day functioning, how they are based on these fundamental abilities related to learning and memory, things like that. And we try to study that from a physiological perspective. What that means is that we study particular patterns of activation in the brain, which we call brain oscillations, brain rhythms. We examine what is the role of those brain rhythms in the service of these cognitive functions. And we develop tools, neuromodulation tools, that help us modify those brain oscillations so that we can change cognitive function, particularly in individuals who might be experiencing some disturbances, some cognitive disturbances, such as memory dysfunction, or in certain neuropsychiatric illnesses when people might be experiencing some symptoms.
So, in the literature in the lab, it says causal neural mechanisms. So a severe case, might mean one thing, but what does that word causal mean in the context of a neural mechanism?
My suspicion is that we might have perhaps, I'm going to have to cross-check that. My suspicion is that the word might be causal as opposed to casual.
Sure. By the way, that's what I read.
I may have read it wrong.
Shrey, I'm really glad you brought that up because
Thank you for correcting me.
Causal.
Yeah, that's good. Yeah, you're right. That's
okay.
Okay. Well, you see, I read it wrong. So I think what does causal neural mechanisms mean?
Right. So this relates to a central theme in a lot of scientific research. The phrase that we often hear, correlation does not necessarily imply causation. Most neuroscience research tends to be correlational in nature. What that means is that we control what the subject is doing. It could be a human, it could be a non-human primate, it could be a rodent. We control what the subject is doing. We have the subject do different things, and then we examine how the patterns of brain activity differ across those different conditions. Now, this usually gives us correlational evidence. If we change the state of the organism, what changes occur in brain activity? That's the correlational, the more traditional approach. Most of the neuroimaging research that we see tends to be correlational in nature. You have someone sit inside the scanner, you have them close their eyes versus open their eyes, and you see how the patterns of brain activity differ. A causal approach tries to invert this process. What we try to do is that we try to alter brain activity directly and see the consequences it has on behavior.
What do you mean? Because I assume you're using non-invasive stimulation. So, when we say we're going to
give us an example of how you would do that.
Right. So we know that certain kinds of brain activation patterns are hypothesized to be related to certain behavioral states. As an example, when you pay attention, when you really pay attention to certain thing, when you really focus on something on the screen or on the paper that's in front of you, we find that patterns of activation in the back of your head, there is a rhythmic activity pattern that we usually observe, and that goes down. Now, if we want to find causal evidence for this, what we try to do is that using these non-invasive brain stimulation approaches, we call this process as entrainment. We apply these very weak electrical currents on the scalp, which are designed to elevate those rhythmic activation patterns in a certain brain region. And then we observe, does it actually impair someone's ability to pay attention, or does it enhance someone's ability to pay attention? So we use these non-invasive approaches, which are designed to alter specific patterns of brain activity, and we observe what the consequences of behavior are. Another example would be in some of the ongoing work in the lab, we are very much interested in what sort of brain activity patterns face some abnormalities as we age. So what we try to do is that we use these brain stimulation approaches to synchronize, to almost zap the brain and sort of reignite those patterns of activation which have become abnormal. And then we see, does it actually improve memory?
Wow. Oh, please. I hope you're doing this just in time for me to get the treatment.
So when we talk about the senses in the, that the mind can, we have touch and all these different ways, sight and smell, but it's sort of reductionist in a way. I don't know who came up with these senses. So do we know the difference whether, you put something on that touches my scalp, whether it's a song, whether it's light coming in, like, there's all these different ways that I imagine it would trigger the brain waves. Do you test them against one another? Like, how do you think about all the different ways you might affect it? And then, of course, you could start treating somebody with certain drugs, and does it make a difference what patterns are happening in the lights or whatever with the as it relates to a specific drug?
So that's a good point with regard to the ways in which we can stimulate the brain. Yes, we can stimulate the brain in several different ways. We can take advantage of the fact that we have these sensory abilities that allow us to interact with the world. Some approaches of stimulating the brain involve sensory stimulation. So you might be presented with some rapidly flickering visual images or rapidly flickering sounds, and those can be used to alter brain activity patterns as well. The approach that we use is electrical stimulation. We call it transcranial electrical stimulation. In our approach, we apply electrical currents on the scalp. And these electrical currents then propagate into your brain. Our brain is quite conductive. So these electrical currents propagate into the brain. And because brain cells communicate with each other using electrical signals, we are basically providing the energy that in the same form that the brain uses to communicate, the cells use to communicate with each other. So in some ways, we are directly providing the energy that is needed for the brain to function. That's a very, very coarse level explanation that I'm giving here, but we use electrical stimulation. Now, with regard to how these stimulation approaches can interact with drugs, with medication, yes, they can interact. There are, in fact, specific experiments that are designed to see the interaction between brain stimulation, the way we do it using electrical stimulation, and the impacts of certain drugs. And this form of approach is actually quite useful in understanding how brain stimulation works in the first place. The studies that we've been performing, that we've been reporting so far, are on healthy individuals, healthy older adults, or healthy young adults. So typically, we are not particularly interested in how our stimulation is interacting with a particular medication that might have been prescribed to individuals for, say, memory deficits. So we are currently not investigating that, but it can have an impact. And for certain kinds of research questions, you may want to control for that by, as an example, in various clinical designs, when people are developing brain stimulation approaches for people with some neuropsychiatric illnesses, you often include certain criteria as to who can participate in your study, and you generally include those participants who've been on a stable medication for a relatively long period of time, so that any changes that are happening due to stimulation do not interact with the changes that might be happening due to medication. So you try to control for that in specific designs when you're dealing with clinical populations, although that's not something that we've had to worry about in our studies so far.
I think you talked about this, OCD. And first of all, could you just describe briefly what that is? And then it seems like it, again, not knowing anything, like this repetition of thing that's driving you to do an action over and over again. So how might that possibly stop that rut or that kind of repetition? It's almost like the thing got stuck on right? If you could just explain how that might work.
Absolutely. In our work, what we've been trying to do is figure out what are the cognitive functions that might be related to clinical symptoms. And within the field of obsessive compulsive pathology, there is increasing evidence that obsessive compulsive behaviors are related to abnormalities in reward processing, how we process rewarding information, how we learn from rewarding feedback in the environment is something which is related to how often we tend to repeat the actions that led to rewards previously. And obsessive compulsive, one of the factors that contributes to obsessive compulsive pathology is that there is this hyper responsivity to rewards. Instead of having a nuanced, regulated response to rewarding feedback, there is a hyperactive response to rewarding feedback. The consequence of that could be that it leads people to perhaps continuously engage in those actions that have previously led to rewarding outcomes, even when those actions have ceased to produce rewards going ahead in the future. So perhaps, checking a lock may have been particularly helpful in the past at some point, but perhaps it's not that meaningful anymore. But simply because there is that hyperactive association with those responses in the past, it's something which people just find it difficult to get out of. Now, what we've tried to do is that we've tried to figure out what are the activation patterns, the activity patterns in the brain, which are responsible for reward processing. Based on that body of work, we've tried to come up with a brain stimulation target that we'll try to engage those reward processing mechanisms in the brain of individuals who might be experiencing obsessive compulsive tendencies. And then we'll perform brain stimulation while they are engaged in reward processing. Using that, we observed that individuals' obsessive compulsive pathology symptoms reduced over time. And we think that, at least based on the data that we currently have available, we are running some new studies right now, but based on the data we currently have available, we thought that our brain stimulation approach promoted exploration. There are these two approaches that we often use when we have to make decisions about what to do. We tend to exploit, which means that we tend to repeatedly do things that we've done before, or we are exploratory. We try and give some weightage to new options, new actions that we haven't yet explored before, that we haven't tried before. Based on the data that we've examined so far, we find that our brain stimulation approach tends to promote these exploratory tendencies. And potentially by facilitating these exploratory tendencies, we allow individuals to break out of that rut. All of this ties to these reward processing. We think that we might be normalizing that hyper responsivity to rewards. And that's what allows people to perhaps be a little more exploratory and not get stuck onto those actions that have previously led to rewards.
You alluded to the fact that earlier that somebody needs to be stable in what they're doing. Do you find that whatever you're doing to stimulate the brain is repeatable? If we did clinical trials of aspirin, we wouldn't necessarily we know it works, but we don't really understand the underlying mechanism. So repeatability strikes me as an important thing. So as you're doing these stimulations, are they repeatable, and what avenues does it open for the future?
So just to clarify, by repeatability, are you saying that, say, if we were to run the same study again, would we observe the same results?
Yeah.
That's a great question. Now, at least in the context of one of our recent memory studies in which we were examining memory improvements in older people, there we tried to replicate the findings in an independent sample. And there we did find evidence that we could replicate those memory enhancements in a new sample of participants. More generally, this field of brain stimulation, and generally several electrical brain stimulation approaches that are currently being investigated, there is a critique as to how reliable the findings are, how replicable the findings are. And for that, people are firstly trying to identify what factors influence outcomes of these brain stimulation designs. What are the important factors that we need to control for that lead to reliable, replicable outcomes? So there's a lot of research going on into just understanding the mechanisms which will help us inform those parameters. People have performed these statistical approaches like meta-analyses to figure out how reliable the findings are. And at least based on published literature so far, there is some evidence to suggest that these findings are reliable. Having said that, we definitely need studies with much larger sample sizes, studies that are replicated in different laboratories with different populations. We definitely need that. So it's something which will definitely take more years and more studies to really gauge just how reliable and replicable the findings might be.
Now, people who, for example, not to reveal too much, when I was little, I had a thing about locking the door. That's exactly what you said. And I would go home and it was like a crazy thing. And I eventually kind of worked my way out of it. And I was really little, like, 10 years old. But, the kind of the work that you're doing, would it go hand in hand with other techniques? Like, in other words, what you're proposing or studying, then you'd be working with clinicians to say this could be, not the only, there's another thing we might consider, is that how we might think about this work? Like, how would it be used in a clinical setting?
Absolutely. This is actually one of the things we are currently interested in. Our previous work has been on individuals with subclinical obsessive compulsive behaviors, and we are currently expanding that to individuals who might have clinically severe obsessive compulsive disorder. And there we are taking into account how our approaches stand against existing treatments, individuals who might be undergoing medication, individuals who might be undergoing some form of psychotherapy. And the idea here is not to replace existing methodologies. In fact, brain stimulation work is still really new, and it's going to take several years for us to figure out really just how strong it is. But the idea is to perhaps add another tool, another approach through which we can potentially have these meaningful clinical benefits, particularly in individuals who may not be experiencing benefits through regular medication or psychotherapeutic approaches. For such cases, people have investigated deep brain stimulation technology, where we implant electrodes in the brain and try to alter brain activity that way. The work that we are doing is similar to that, but in a manner that's more accessible. It doesn't require surgery. It doesn't require any invasive procedures. So hopefully, if it's replicated and found to be reliable, it is something which can be potentially added onto the set of tools that a clinician or a patient might have available to them to explore what sort of treatment combinations might work best for them.
So candidates for this might be people who are getting older, feel like they're losing memory. What about soldiers returning with brain injuries, from military situations? Are they a candidate for this?
So while in our current work, we haven't investigated that, it is something which is under investigation in other labs. For example, treatment of post-traumatic stress disorder. Can we use brain stimulation to reduce symptoms related to that? That is something which is under investigation in other research groups. So certainly, if we observe improvements in memory function in healthy older individuals, we are currently trying to expand that to pathological aging, individuals who may have mild cognitive impairment, Alzheimer's disease, Parkinson's disease. So potentially, yes, there is always an avenue of tailoring these interventions to specific clinical populations who might be experiencing memory disturbances as well. We haven't yet explored that in the context of soldiers specifically, but theoretically it seems plausible.
Have there been things that you've seen that have surprised you when you've been doing this research?
So I would say that the most surprising aspect for us engaged in brain stimulation research is the ability to, or evidence suggesting long-lasting improvements. This is something we've observed in our memory research as well as in our obsessive compulsive behaviors research. This is something which is quite new for us and new for brain stimulation field in general. Most of the work that relates to these electrical brain stimulation approaches, it tends to be quite short-lived. We usually observe changes that last for a few hours at max. Generally, it's in the order of minutes. But the ability to observe improvements for much longer time periods is what's really interesting to us, because that's what drives the potential clinical benefits of these approaches to us. Because if we are undergoing an intervention, we really want changes that last for long periods of time. Now, even right now, we've observed these changes only in the order of months. Hopefully, going forward, we might be able to expand and see whether these changes can outlast 3 months, which is the maximum duration that we currently examined. So it's the sustainability of these outcomes which is the most exciting and most encouraging for us.
Have you looked at it for Alzheimer's patients?
We are in the process of doing that right now. We are currently putting together a set of experiments which will allow us to see whether we can improve memory function in individuals with Alzheimer's disease.
In addition to these sort of jarring, or I wouldn't know how to categorize them, these kind of events that are aggressive. What about a condition like a depression, for example, which is not, an over and a repeatable behavior? Where does this work come in with something like that, condition like that?
There's a growing body of work in which these electrical stimulation tools have been used to alleviate symptoms of depression. And it's encouraging. Of course, these are still far from being full-fledged clinical trials, although there's work happening on that front as well. But the central premise here is that if we take a particular neuropsychiatric illness, we decompose it into its constituent cognitive elements. For example, depression, as opposed to hyper-responsivity to rewards that I was talking about in obsessive-compulsive behaviors, depression is characterized as hypo-responsivity to rewards. Now, once you have identified what are the characteristics in the brain which relate to hypoactive reward processing, you can then tailor these brain stimulation devices, brain stimulation approaches to alter that specific cognitive function. So in that sense, we have a fair bit of flexibility. We can decompose a given set of symptoms to the extent possible into their constituent cognitive elements or affective emotional elements, figure out what patterns of brain activity are related to those cognitive or emotional processing, and then design these brain stimulation approaches accordingly.
So in the first bucket of that, how would you identify a person's depressed? Is there, you put them in the scanner, it tells you what you ask them a question, it says, well, I'm depressed. And then you look at what they're thinking, and then you see if you can affect that brainwave.
So typically, the first level of classification or diagnosis is done by a clinician. A clinician and a psychiatric or clinical psychologist would often perform a series of assessments in which these are basically structured clinical interviews. They would be interacting with the subject, discussing with them about their experiences, about what they are feeling, what they are thinking. And on the basis of that, a trained clinician would come to a diagnosis. We would work with individuals who have been diagnosed by a clinician. And then we would compare their brain activity against individuals who've not been diagnosed with any condition. So we typically rely on these clinician-based metrics to identify who may have depression versus who may not have depression. At the same time, we also acquire certain other measures. For example, we typically ask people to fill out some assessments, some pen and paper assessments in which they rate the severity of their symptoms. And we examine how patterns of brain activity correlate with the differences in symptoms that individuals with depression who've been diagnosed with depression might be demonstrating. So we primarily rely on clinician metrics, but afterwards we tend to acquire some data at our level also, which helps us get some additional information that supplements the clinician information.
Is the doctor on your team? Is there a doctor on the team?
So when we work with clinical populations, the work that we've been focused on so far that we've reported is with healthy individuals, healthy older individuals, or individuals with subclinical obsessive compulsive behavior. But previously, my advisor has worked with schizophrenia patients, and currently we are working with individuals with OCD as well as Alzheimer's disease. In such cases, yes, There will be a clinician, professors in the department, they often collaborate with each other. So there's usually a clinician on board for a given project who will be helping us with clinician-related steps of the study.
So a person with schizophrenia, you wouldn't even necessarily be able to, how do you measure their brain waves? Because it's an unusual set of brain waves, no? Can you see something different in a person with schizophrenia than somebody who's, use that word normal, but what does it really mean?
That's a good point. And by normal, I think I primarily mean individuals who've not been diagnosed with a clinical condition.
Mm-hmm.
Actually, there's a large body of work in schizophrenia looking at brain waves. And there are certain characteristic rhythmic waves which are found to be different in individuals with schizophrenia. So there is a large body of work that guides our schizophrenia investigations. And typically, the procedure would function similar to how previous investigations have done it, in which you would have individuals who've been clinically diagnosed with schizophrenia using the instruments that a clinician might use, that a psychiatrist or a clinical psychologist might use. And then we bring them into the lab, we measure their brain waves, and we compare their brain waves against individuals who have not been diagnosed with any illness. And these kinds of comparisons have yielded certain specific activation patterns. For example, there is this very fast rhythmic activity that's usually observed in the back of the head, in the brain regions that are responsible for processing visual information, that's found to be operating differently in schizophrenia patients.
What kind of, is it the same kind of, I have to go get inside the machine, or how do you measure
what's the process? Yeah, how do you do it?
Oh, so individuals usually have a cap placed on their head.
Mm-hmm.
This is like a swimmer's cap, an elastic cap that's usually wrapped around the head. And this cap has some sensors embedded in it, which rest on a participant's scalp. These sensors record the electrical activity that our brain naturally produces. These are sensitive sensors which can record minor fluctuations in voltages on our scalp. Now, we place a little bit of gel under each of those electrodes. Typically, there are about 64 to 128 electrodes, these channels on someone's scalp. We put a little bit of gel under each of them, which helps us record these activity better. And then we connect them to a system which is connected to our monitors outside, on which we can see these brain waves. We also have to perform several kinds of analyses after the data has been collected to really be able to see the brain waves clearly. But we can still see voltage fluctuations while the subject is sitting inside a booth. They're usually in a radio frequency shielded booth, and we can see these fluctuations in their voltages outside. Now, when we perform brain stimulation, it's a similar process. You have a different set of electrodes that are placed on the scalp. And again, you have some gel under those electrodes, which makes the connection proper between the scalp and the electrode. These electrodes are connected to a battery-driven device, and this device delivers these electrical currents for the duration and in the pattern that we designed for a given study.
So these studies that you're doing, can you eventually take them to people's houses? Can you leave the lab, or does the study really need to be in the lab to meet all the conditions that we're trying to meet?
The approach that we use to measure brain waves, that's electroencephalography or EEG. There is considerable research going on, including here in my university at BU, where we are investigating whether we can develop devices that are not limited to the lab. Wearable EEG is an area which has received quite a lot of attention in recent years. So there's definitely some attempts going on to make it easier for us to record brain activity while people are engaged in their naturalistic day-to-day activities and not in lab-based environments. On the brain stimulation front as well, there is research going on right now. It's not as extensive as the EEG research, but there is research going on right now as to whether we can develop devices that individuals can perhaps bring with them in their homes and perform brain stimulation on their own rather than in a lab-based environment. However, I must mention that because the brain stimulation approach is purely investigational in nature right now, we have been emphasizing to our participants that this is something that we do in the lab, in the presence of individuals who are familiar with what the safety parameters are, what are the constraints within which we have to operate. My suspicion is that it will take a little more research to really be able to bring this into out of lab use right now.
Do you think it's possible you're going to see very different results depending on where you are when you test them? I mean, certain pieces of the brain can just be taken out and the brain can regrow them. It's a very complex organism or very complex organ. What are your thoughts about whether, in fact, where you take the test matters?
I think it matters a lot. In lab-based studies, our focus is on isolating a particular ability, a particular cognitive function, which is why we perform these lab-based studies in the first place, where we try to control several different variables that allow us to speak to a particular cognitive function. If our objective is to see whether our brain stimulation technology improves memory function, the reason we do this in a lab-based setting is so that we can eliminate all the other different variables that can potentially serve as confounds. I would say that once the brain stimulation technology and our understanding of the brain has evolved to the extent where we know for sure that a particular brain stimulation design will only impact memory function and nothing else, at that point, I suspect that it might be easier to extrapolate it to an out-of-lab setting. Right now, since we are still learning things, it is a bit easier to do that in the lab where we can control several variables.
You have all these different areas that you're on the website, at least exploring: reactive control, proactive, computational memory. You have these categories: illness, consciousness, aging. Do you think that, I mean, this is a crazy leap, but over time, we want to, hopefully the idea would be to repair things that might not be working, or to help be a part of an arsenal of tools that would work with people with cognitive or, other disorders. But also, is there a scenario where we would also just improve brain function overall, not to say make somebody smarter, but get the optimal functioning power of a brain? I mean, is that ultimate? And that sounds like science fiction, but is there something we could be working towards, that everybody has this extraordinary organ? Can we make it better, the best of? What do you think about that?
I think that's a valid possibility. We would have to know what the optimal level is in the first place that we are working towards. But certainly, as an example, this is something which we often, when we discuss these brain stimulation approaches, we often use this, that say you have individuals who particularly need to be attentive in their jobs, individuals, say air traffic controllers, or individuals who are on the road for several hours a day. For such individuals, it is even more essential that their ability to pay attention operate at optimal levels for long periods of time than any other random person. So is it possible to have any interventions? They need not be brain stimulation-based interventions. They could be cognitive training, any form of intervention that elevates their attentional abilities to a level that allows them to operate optimally for long periods of time. That is welcome. So definitely it's something that is possible. And if that's something which is possible with electrical brain stimulation approaches, that would definitely be an interesting area for the field to explore.
There's footage online of an Alzheimer's patient being played music from their past, and suddenly their memory returns for a few moments, and then as if it's in a fog, it disappears again. Does this all lead us to think that there may be things up ahead that are, could be quite incredible about this research?
We certainly hope so. Specifically about your example, this relates a little bit to some of the work that we've recently done, in that when we think of memory function, it's not a unitary thing. It's not like memory is this one thing. Memory is of different kinds, of different types, and certain kinds of memory function might be particularly impacted by certain conditions. Alzheimer's disease, for example, tends to impact episodic memory, our ability to associate, to remember events, a lot more than it affects our ability to engage in what we call procedural memory. Things about how to tie our laces. It does affect that too at later stages, more severe stages. But there are these distinctions in how different memory functions, how they change with aging or with pathology. So what we are trying to do is to learn more about these distinctions among different memory functions and develop brain stimulation devices, brain stimulation tools that are catered to each of those memory functions. And as we learn more about this, definitely there's a lot more scope. Our understanding of the brain will help us figure out what exactly is at the root cause of a given illness, or what are the root causes of a given illness, and then develop interventions appropriately. So there's definitely much more to be learned. We think that it's an exciting time to be engaged in neuroscience research and even in brain stimulation research.
Yeah, well, it's really fascinating, and for a lot of people, I think it could really be a helpful new way to treat them. So, how long do you think it'll be before you some of your things make it out of the lab? I mean, they seem non-invasive, so it doesn't seem that difficult.
The thing is, as you mentioned previously about repeatability, that's the critical factor.
Right.
It takes time for a large body of work to establish itself and then gain all the necessary approvals from regulatory authorities. So that process can take several years. Right now, our emphasis is to make sure that the work we are doing, we can replicate that in newer samples, in newer clinical populations, and that work finds support, or broadly the field, if it comes together and identifies optimal designs that might be different from what we've proposed, but still evidence that is replicated several times in larger samples. That's what's needed. So that's something which I expect would still take several years. Other kinds of brain stimulation technologies, TMS, transcranial magnetic stimulation, for example, I believe the technique started in the 1980s, and it was only within the last decade that we established enough evidence to be able to gain clearance for things like depression as alternative means of treating depression.
Right.
So it will take some time, but we are hopeful that with the interest that this technique has garnered and our improved understanding of the brain itself, we hopefully might be able to accelerate that process.
Yeah, I mean, it's interesting. Before COVID, Jesse and I met with a group of people from the Brain Institute, at the UN actually, and there is, an international cohort. And what they told us, all these extraordinary neuroscientists from around the world, is that, it's the one part of the body people don't know anything about. I mean, we just don't know yet. And yet we now find ourselves with mental health crises all over the world. And you would think this would be like a priority number one, because, and it's so, how can just even people watching and listening, how do we support this work that you and your colleagues around the world are doing? Because what you're talking about, you just think of all of the sort of tragedies that we see. If we could get access to this kind of stimulation early on and do early interventions someday, maybe some of the real despair that we're seeing in our world, we could mitigate, or at least try to slow it down. Any thoughts around that, just from your perspective?
I know that the neuroscience community is trying to engage in a lot more groundbreaking research that can help us better understand how the brain works and what goes wrong in case of illnesses. I would say that for us working in the field, what's most encouraging is when individuals show interest in this work, because when individuals show interest in this work, it provides us the resources necessary in doing even more exciting work. So the thing that people can provide us is their interest, is that the excitement about the brain and how to go about understanding the brain. On a more practical level, we are always happy if individuals reach out to us and are interested in participating in the studies. We often have several studies going on in the lab, and it's helpful when people reach out and say that they'd like to participate. We are always looking for larger sample sizes and
Very good. Okay.
individuals. So that's
okay. Do you have anything happening in California? I'm happy to participate.
Currently, all our studies are based in Boston, but we know that there are several labs all over the country which are doing amazing research, and particularly brain stimulation research. So, if you were to ask us for recommendations around California, we'd be happy to provide you that, and you'll be contributing to science regardless, even if it's not specifically in our lab.
Okay.
Yeah. Thank you very much.
Great. Thank you so much for the work you're doing. Nice to
Thank
meet
you so much. Nice to
Bye,
meet
guys.
you.